Hormonal contraception, mechanisms, methods, and clinical applications. Hormonal contraception represents a major advancement in reproductive health, offering highly effective pregnancy prevention through various delivery systems. These methods work by modifying hormonal patterns to prevent ovulation and alter reproductive tract conditions. Understanding hormonal contraception. Hormonal contraception encompasses a diverse range of birth control approaches that function by influencing the body's endocrine system to prevent pregnancy. These methods fundamentally alter the delicate hormonal balance necessary for conception, creating multiple barriers to fertilization and embryo implantation. The category primarily utilizes synthetic steroid hormones that mimic or modulate the body's natural reproductive hormones. Since the introduction of the first combined oral contraceptive pill in 1960, the field has expanded dramatically to include numerous delivery mechanisms that accommodate different lifestyle needs and preferences. Understanding how these methods work provides insight into their effectiveness and helps individuals make informed contraceptive choices. Historical development and evolution. The landscape of contraceptive technology underwent revolutionary change in the early 1960s when the combined oral contraceptive pill became commercially available. This breakthrough represented the first widely accessible, reversible, and highly controllable contraceptive method for women, fundamentally transforming reproductive autonomy and family planning options. The success of this initial formulation inspired decades of research and innovation, leading to the development of alternative delivery systems and modified hormone combinations. Over the subsequent decades, pharmaceutical scientists refined hormone doses, identified safer formulations, and created products tailored to different patient populations and medical conditions. This evolution reflects both improved understanding of reproductive physiology and growing awareness of potential side effects requiring mitigation. Mechanisms of hormonal contraceptive action. Hormonal contraceptives prevent pregnancy through multiple simultaneous mechanisms, creating redundant protective pathways. The primary mechanism involves suppression of ovulation by altering the secretion patterns of follicle-stimulating hormone and luteinizing hormone, the key regulators of egg development and release. Beyond ovulation suppression, these methods thicken cervical mucus, creating a barrier that impedes sperm transport through the reproductive tract. Additionally, they modify the uterine lining structure, potentially reducing the likelihood of successful embryo implantation should fertilization occur. Some formulations also alter the motility of the fallopian tubes, further reducing the probability of gamete meeting. This multifaceted approach explains why hormonal contraceptives maintain such high efficacy rates even when used imperfectly. Available delivery methods. Key points: oral contraceptive pills remain the most widely used hormonal method globally, offering daily dosing with excellent reversibility and user control. Injectable formulations provide extended protection lasting 3 months or longer, reducing the frequency of administration required. Transdermal patches deliver consistent hormone levels through the skin, eliminating daily pill requirements while maintaining excellent compliance. Vaginal rings release hormones directly into the bloodstream through vaginal tissue absorption, offering 3-week cycles with 1-week hormone-free intervals. Effectiveness and contraceptive failure rates. When used according to prescribed schedules and instructions, hormonal steroid contraceptives demonstrate exceptional efficacy, with typical pregnancy rates falling below 1% annually. Perfect use scenarios, where users maintain meticulous adherence to protocols, yield even more impressive results, generally achieving pregnancy rates around 0.3% or lower. These outstanding effectiveness rates derive from the redundant protective mechanisms inherent in hormonal contraceptive action, meaning that imperfect use still maintains substantial protection. Real-world effectiveness varies depending on method type, user consistency, and individual physiological factors, but all hormonal approaches substantially reduce pregnancy risk compared to unprotected intercourse. The distinction between perfect use and typical use failure rates highlights the importance of selecting methods that align with individual lifestyle and adherence capabilities. Hormonal composition and types. Nearly all hormonal contraceptives rely on synthetic steroid hormones derived from or chemically similar to naturally occurring reproductive hormones. The most common formulations contain combinations of estrogen and progestin, synthetic versions of progesterone that provide robust pregnancy prevention. Progestin-only methods, sometimes called mini-pills, offer alternatives for individuals who cannot tolerate estrogen or who are breastfeeding. Different progestin types and estrogen dose variations allow clinicians to customize approaches based on individual tolerance and medical history. A notable exception exists in certain markets where selective estrogen receptor modulators have been marketed as contraceptive agents, offering a distinct pharmacological approach. This chemical diversity enables personalization of contraceptive selection to match specific patient needs and health considerations. Clinical benefits beyond contraception. Beyond their primary contraceptive function, hormonal methods provide numerous therapeutic benefits that extend their clinical utility. Many users experience significant reduction in menstrual pain, lighter menstrual bleeding, and improved regulation of previously irregular cycles. These improvements in menstrual patterns often contribute substantially to quality of life and work productivity. Certain formulations demonstrate efficacy in managing acne through hormonal regulation of sebaceous gland activity. Some hormonal contraceptives help alleviate symptoms of polycystic ovary syndrome and reduce the risk of developing functional ovarian cysts. Additionally, long-term users typically experience reduced incidence of ovarian and endometrial cancers, and some methods decrease rates of pelvic inflammatory disease. These ancillary benefits make hormonal contraception valuable beyond simple pregnancy prevention for many individuals. Considerations and potential side effects. While hormonal contraceptives are generally well tolerated, potential side effects warrant discussion and consideration when selecting methods. Some users experience mild nausea, particularly during initial use periods, which typically resolves within several cycles. Breast tenderness, mood changes, and headaches occur in some individuals but often stabilize with continued use or formula adjustment. More serious but uncommon complications include increased thrombotic risk, particularly with estrogen-containing formulations in individuals with specific risk factors. Clinicians must carefully screen for contraindications including personal or family history of blood clots, migraine with aura, and uncontrolled hypertension. Current smokers over age 35 face elevated cardiovascular risks with estrogen-containing methods. Comprehensive medical evaluation prior to initiation helps identify individuals for whom alternative contraceptive approaches might be more appropriate, ensuring that benefits substantially outweigh potential risks. Special populations and adaptation. Certain patient populations require special consideration when selecting hormonal contraceptive methods. Individuals with a history of migraine with aura may face elevated stroke risk with estrogen-containing formulations, prompting consideration of progestin-only alternatives. Those with severe liver disease or hepatic tumors require careful evaluation before estrogen use due to altered hormone metabolism. Breastfeeding women can safely utilize progestin-only methods without compromising milk supply or infant health, though most combined formulations remain relatively compatible with nursing when initiated appropriately. Adolescents benefit from long-acting reversible methods that eliminate adherence concerns during developmentally demanding years. Perimenopausal women transitioning through reproductive stage changes may appreciate hormonal contraceptives that simultaneously manage contraception and regulate the erratic bleeding patterns common to this life stage. Individualizing contraceptive selection based on life circumstances and health status optimizes outcomes and user satisfaction. Research directions and future developments. Current contraceptive technology remains limited to female-based methods, though active research efforts continue exploring male hormonal contraceptive options. Scientists investigate novel hormonal agents with improved safety profiles and reduced side effect burdens. Extended cycle formulations that minimize menstruation frequency continue evolving to address user preferences for reduced bleeding. Combination products incorporating non-hormonal mechanisms alongside hormonal components may enhance effectiveness and expand options for individuals with contraindications to pure hormonal approaches. Development of longer-acting formulations continues, with research targeting multi-year protection requiring minimal user intervention. Furthermore, investigations into personalized medicine approaches may eventually enable selection of contraceptive formulations based on individual genetic and biochemical profiles, optimizing efficacy and minimizing adverse effects through precision medicine principles. Integration into comprehensive reproductive healthcare. Hormonal contraception functions most effectively as part of comprehensive reproductive health management rather than as an isolated intervention. Concurrent discussions about sexually transmitted infection prevention, cervical cancer screening, and general health optimization enhance overall outcomes and patient satisfaction. Healthcare providers should integrate contraceptive counseling with discussions of fertility intentions, family planning timelines, and reproductive health goals. Regular follow-up appointments allow assessment of method tolerance, discussion of emerging concerns, and timely adjustments when necessary. Shared decision-making frameworks that respect individual values, preferences, and medical circumstances lead to improved adherence and satisfaction. When hormonal contraception serves as one component of integrated reproductive health care, individuals benefit from improved access to preventive services, health screening, and support for overall well-being across the lifespan. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.